The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
April is National Donate Life Month. Right now, more than 3,000 people in the U.S. await a heart transplant. Here to share how organ donation gives people a second chance at life, we welcome from Providence Heart Institute heart transplant surgeon Kevin Koomalsingh. Doctor, good to see you. Tell me about the demand, though. How we mentioned more than 3,000 people waiting. It's a pretty intense demand.
It is. Good morning, Helen. Thanks for having us here today and allowing us to share some of our work. The demand for heart transplant is pretty high. As you mentioned, there are over 3,000 patients awaiting a heart transplant, and supply is always low. And so patients are at the mercy of available donors.
What's involved in a heart transplant?
So it's actually quite a process. At first, patients get evaluated to determine their eligibility for the appropriateness of being on a heart transplant wait list. Then they get on the wait list. Then a donor becomes available. And then finally, there's the transplant event. And the transplant event involves a team going out to retrieve the organ and bring the organ back for it to be transplanted.
Now, when you're on a waiting list for a heart, do you automatically, if someone gets a heart, then you're number two, you're up next on the list? How does that work?
Yeah, so it's quite a dynamic list. There are lots of factors in play, but the two largest factors are medical urgency and actual distance from the donor hospital. So this allows fair organ sharing for those in greatest need.
And you say distance, so if someone's awaiting a heart transplant, they should get as close as they can to the hospital they'd be getting the transplant at, right?
Correct. Well, since organs are under sort of a time constraint, they can only be out of the body for certain amounts of time. It's not practical to travel great distances to get an organ. And so the sort of geography to the donor hospital is in consideration where you'd stand on the waiting list.
Who determines which patient gets the heart?
And so that all comes down to what's called a national match run. So when a donor becomes available, there's a national match run, and the recipient is at some sequence number on that list.
I'm sure your goal here is to make sure that everyone out here has an organ donor card, and that we let everyone know that if that happens, that we want our organs donated. Are there problems when someone has it on their driver's license, say that they agree to be an organ donor, and then the family doesn't want to do that?
Correct. These are always challenges for donation and transplantation. That's why, our best sort of recommendation is for everyone in the community to take a moment and consider becoming an organ donor, to make their wishes known to their families and loved ones, and actually take a moment and sign up to be an organ donor, either through the DMV or Donate Life Northwest.
Let's go back to eligibility for someone who's waiting for a heart. Besides distance, what else? Do they need to be in good health otherwise?
So usually medical urgency. So
okay, right.
They do have to be sick enough that they need a transplant as soon as possible. So the way the system works is that those in greatest need get the organ faster than those who are less sick.
Let's say the one person awaiting a heart transplant is a smoker. Does that make a difference?
There are some things we look at when we're evaluating someone for appropriate candidacy. We do comb through certain habits and try to help patients sort of separate from those habits before eligibility.
It seems to me, though, that so much good can be done when someone is able to donate an organ of a family member, say, and save lives.
That's right. A single donor can save over 8 individuals through organs, tissues, and even eye donation.
Yeah, absolutely. I know I've heard about the Nicholas effect, the young boy in Italy that died and donated his organs and saved, I think, 6 people.
That's right.
Yeah.
Yep.
It's incredible. We want folks to know if you would like to find out more, all you have to do is contact Providence Heart Institute. We'll put all that information for you on our website, the phone number you see on our screen, but just go to KATU.com. Doctor, thank you so much, and thank you for all you do.
Oh, you're very welcome. Thanks for having me.
You bet.